Good morning or afternoon, depending on your location. I'm Ali Santore, and I serve as the Executive Vice President and Chief Administrative Officer with Providence. And I'm privileged to serve as our moderator of this esteemed panel today, which includes some of my good friends and colleagues from across the healthcare sector. Today, we'll be discussing healthcare's path to decarbonization, addressing key risks and fostering resilience. This is the second webinar in the series, and our specific topic today is going to focus on the legal implications of decarbonizing health systems. I will provide some opening comments and then begin a question and answer session so we can hear from our panelists. And finally, we would love to take questions from the audience after we go through the roundtable Q&A. So I encourage you to listen for opportunities to ask questions and engage with our panelists. Please give them all of the hardest questions, which is my right as a moderator to ask for because I don't have to answer them. But before I start with some framing comments, I want to turn it over to our panelists for their introductions. So I will start with Dr. Balbus.
Thanks so much, Ali. Good morning, good afternoon, everybody. I'm John Balbus. I am currently principal of Climate Care Consulting, LLC. Before that, I spent 15 years in the federal government, the last 3 of them directing the Office of Climate Change and Health Equity within the Department of Health and Human Services.
Thank you, John. Ann?
Thank you very much, and good morning, good afternoon, everyone. I'm delighted to be here. I'm the Director of Sustainability for the City of Newton, which is a city just outside, a suburb of Boston, a population about 90,000. I have lived in Massachusetts many years and served as Undersecretary for Energy in Massachusetts under Governor Patrick, and then as Chair of the Department of Public Utilities, also under Governor Patrick.
Thank you, Ann. And Rochelle?
Hello, everyone. Thank you so much for the invitation to join all of you. I'm Rochelle Reyes-Wenger. I'm the Assistant Vice President of Public Policy and Advocacy Engagement. I spend a lot of my time working on health equity and social drivers of health policy issues. I also wear a programmatic hat in that I oversee the third pillar of our climate action plan, which is the climate resilience pillar. And so I look forward to our discussion today.
Thank you, Rochelle. So why are we here today? The healthcare sector plays a critical role in our communities, but we are also a significant contributor to carbon emissions at nearly 9% of total greenhouse gas emissions in the United States. I know at least at Providence, we have seen the urgency to address climate change intensify as climate change's impact on our community's health continues to grow. So including for us, at least, the devastating wildfires in Los Angeles this year, increasing temperatures across the globe, and more volatile weather patterns overall. To that end, organizations in healthcare are increasingly focused on decarbonization to reduce their environmental impact and build resiliencies in the communities that we serve. This transition, however, involves complex legal, governance, and regulatory considerations that have become even more complex since the change in leadership at the federal level earlier this year. So understanding these implications is vital for our organizations to effectively implement sustainable practices while ensuring compliance with rapidly evolving standards and regulations at both the state and federal level. Additionally, many of these organizations are actively involved in providing care, safety, and education during and after extreme climate-related weather events. As our world warms, this becomes more challenging, requiring forethought and planning and coordination and support from government and other agencies and partners. We have to seek that support in the context of today's political environment. So as our organizations navigate this complex landscape, we've seen a scaling back of the federal commitment, resources, and information to support industries in decarbonization efforts, including healthcare. I'm grateful that we have my good friend, Dr. John Balbus, here today to talk about how we navigate this landscape at the federal level and how things have shifted. At the same time, we know efforts continue at the state, county, and city level. I know from the states that Providence serves in, we are operating California state regulations related to greenhouse gas emissions, Washington clean building standards, carbon tax in Portland, just to name a few. So I'm very grateful we have Ann here to talk about the work that Massachusetts is doing as a state on the leading edge of driving sustainability forward. So we have an opportunity for healthcare to continue to lead in this space. And I believe our call to action resonates now more than ever, given the direct connection to health, to the health of our communities and the warming of our climate and the health of our environment. So healthcare and healthcare leaders are sought out by legislators and regulators for our expertise in managing complex buildings and carbon reduction, including measurement and reporting. I'm also very grateful to have my friend Rochelle here from Common Spirit, who can discuss how her multi-state healthcare system is navigating through the myriad of regulatory and legislative frameworks they operate in. So in addition to these compliance and regulatory frameworks, we have seen an increasing legal framework around liability for environmental harm, and this is continuing to evolve. So healthcare providers need to mitigate risks related to their environmental resiliency, ensuring that our operations, clinicians, communities are prepared to respond to climate-related events. We need to do all that we can, not only to reduce the risk to our organizations. It's not about just risk mitigation, but it's also about how we proactively protect vulnerable populations who we serve, who are disproportionately impacted by climate change. For us at Providence, that is a special part of our commitment to this work. We see this as a matter of justice, and we see it as a matter of health equity as well. So I really appreciate our panel of experts that we have here today who are going to help us navigate through the very complex landscape of regulatory and legal regulations and frameworks that healthcare systems are driving this work forward through. So I will start with Dr. Balbus. And Dr. Balbus, given your incredible background and leadership that you've demonstrated at the federal level, can you describe the recent federal mosaic of regulations and programs relevant to healthcare decarbonization? What has been working? What did the Biden administration under your leadership help drive forward? And what gaps remain? Oh, and you're on mute, John.
It is the mailman time in my house, and so I'm just trying to keep my dog out of this webinar. Thanks for that wonderful opening, Ali. And let me start off by just saying that the whole government interest in healthcare decarbonization has come a lot later than the general economy-wide interest in decarbonization. So what we had was a system where there were, some requirements, some regulations, some resources that were not specifically tailored to the health sector. And in terms of requirements, there was often a threshold. So it was only the biggest health sectors that would be relevant to that. But then when it came later, there were more resources, incentives, guidance, and information really tailored to the health sector just in the last, specifically in the last 3 years with the Biden administration. So we had all of the agencies that were really focused on energy and the environment, especially obviously the Department of Energy had its Better Buildings Initiative, which was, all sectors, but had a specific healthcare sector part of it. That is still in existence. We had the EPA's Energy Star program and the Portfolio Manager, which has been around for decades. That is still up and running at this time. We had the EPA's greenhouse gas reporting program, again, which would have only captured the biggest emitters in the health systems. So far I haven't mentioned anything really HHS specific. So those were the things that were in place that were there to help, all of the sectors that healthcare would sometimes come under. More recently, HHS got involved with the creation of our office and with the executive orders from the Biden administration. So we had things like the Agency for Healthcare Research and Quality's decarbonization primer that was a really definitive guide. Sadly, the primer and, in fact, the whole agency are no longer with us. We had CMS, through its transforming episode accountability model, really take those first steps for an agency like CMS to bring in the issues of energy and decarbonization and resilience of health systems through this Teams initiative. And they had a decarbonization resilience voluntary initiative within the mandatory Teams model. That is now an error page not found. So that is also gone. We had the Health Resources Services Agency administration that provided a lot of technical assistance through its NTAP program, focusing on decarbonization to some degree and resilience. HRSA's budget is under great threat. And then we had the resources that our office was providing. That included the building of a community of practice through the health sector pledge that we had about 140 organizations signed on. We had a federal health systems learning network, which brought together the Veterans Health Administration, the Defense Health Agency, the Bureau of Prisons, the Indian Health Service, that was trying to make the federal government kind of the bellwether or the lead in kind of a coalition of emissions reduction and reporting requirements. And of course, our office was terminated at the beginning of the Trump administration, and the resources that we created are not present on the hhs.gov website anymore. Healthcare Without Harm, a non-governmental organization, has picked up a lot, including trying to pick up that community that had signed on to our pledge through their CARES pledge. I just want to say a quick word too. We're focused on decarbonization, but of course, for the health sector, renewable energy microgrids are a very important part of their resilience as we face increasing power outages and energy challenges. And so we also had a mosaic when it came to resilience. We had the hospital protection program that is slated for that's now gone, basically. The public health emergency preparedness program from CDC, now gone. The ASPR critical infrastructure program, which was a small unit within the Administration for Strategic Preparedness and Response, that whole administration is being folded into something else in HHS. So it's a little bit uncertain, but the funding is being cut for all of their preparedness work. We had the CMS Emergency Preparedness Office. Same thing. It's probably still in existence, but the funding for those kinds of activities at CMS are slated to be reduced. And then, of course, we had the FEMA non-disaster grant programs, the resilience grants, the planning, those are all being slashed. And so we're at a time where the federal government is now calling on the states to take this up, that there are presumably going to be some kind of block grants that will provide funding to the states. And then the presumption is that the states will figure it out for themselves and self-organize. It's a sad day. That mosaic that I described is mostly dismantled within a space of weeks. A lot of that was working. A lot of that was moving the field. There was reporting that was starting. There were communities of practice being developed. So, there were gaps. It was a mosaic. It was pieced together. I think we could probably build it back better, and maybe we'll talk about that later. But we had gotten to a point where the process for getting this built in, getting the health sector built into the nation's renewable energy programs and getting decarbonization and renewable energy built into health policy had moved forward quite a bit. I'll stop there. There are obviously more pieces, but we need to move on.
Yeah, thanks, John. Well, I actually just want to follow up on a couple things that you said. I think that we cannot underscore how important the work that you did and your team at HHS in building momentum for this work across the healthcare sector. So I think all of us on this screen were some of the first signers of that healthcare sector pledge, and we continue the commitment and the passion for that work moving forward. And so I did want to ask though, because that's a lot of really challenging news, and it's a challenging time for health sectors to navigate this work. What are you optimistic about?
Well, just the sentiment that you're expressing, Ali, and thank you for those words. There's um, you know, the thing I'm probably most optimistic about is the spirit and the true commitment that so many of the health systems like yours that made this commitment a few years ago are staying the course. They are not blowing with the wind. They are not saying, "Oh, well, it's a little risky now. We're going to stop talking about." It." Obviously, people are talking about these issues in different words, and we have in devolving responsibility from the federal government to the states, we have, many states where the regulatory environment, the political environment is very hostile to these kinds of considerations. And so people may not be as forward. But what gives me the most hope is just seeing that people are staying the course. I'll say one of the reasons people are staying the course is because it works. These systems are more resilient. They cost less over the long term. And so, I'm optimistic because we know it's got to happen. We got to save money wherever we can in the health system. We got to stay open when the hurricanes and the power outages hit. And we know they're coming fast and furious and worse. So
Mhm.
that's what gives me the most hope is to see the private sector stay the course, but also, the states are staying the course that have started this process.
Yeah, absolutely. Thank you, John. And you mentioned the state's role in filling some of those gaps. And, Massachusetts has been on the forefront of a lot of the leadership across the state level. And can you walk us through the legal and regulatory mandates that impact health systems in your state?
Sure, happy to. And I guess I'll just say, obviously, the states and cities certainly cannot fully replace what the federal government has been doing, but thankfully, we're still here in many cities and states, certainly in Massachusetts. So I'll just briefly run through the environment, legal and regulatory here. So Massachusetts, by statute, so these are not aspirational goals, these are legal requirements. Massachusetts is committed to a 50% reduction in greenhouse gas emissions by 2030, 75% reduction by 2040, and reaching net zero by 2050. And we're not talking just about state government facilities, right? This is for the entire state. That said, these statutory requirements don't specifically address the health sector. And for that, well, not specific, but for laying down actual requirements for large facilities, we have to look to the cities in Massachusetts. So I want to point out specifically Boston, Cambridge, and Newton, which I've said is a fairly large suburb of Boston. And each of those has an ordinance that is the acronym is BERDO, Building Energy Reporting and Disclosure Ordinance. So they're not identical. The three cities don't have identical BERDO type requirements, but they're pretty close. And they require large facilities to reach net zero emissions by for most of these three by 2050. Actually, for Cambridge, for the larger facilities, it's by 2035. So basically, the cities are imposing a requirement of reaching net zero for affected buildings, which are large, and all of them large commercial buildings, and some of the cities also include residential. And there is no exemption for hospitals. There is some flexibility in the ordinances that hospitals may choose to take advantage of, such as the portfolio, the ability to take advantage of essentially pooling buildings in portfolios, and there are also hardship compliance mechanisms. But there is no blanket exemption in any of the three ordinances for hospitals. So they have to comply with the requirement to get to net zero by 2050, or as I've said earlier in Cambridge, for the larger buildings.
Yeah, and that's fascinating that the cities really take the lead. It just shows the adage, you know, all politics are local, and Massachusetts is hyper local in terms of the work and the focus that they have. So that's really interesting, because at Providence, our experience is that it's heavily state-led, with the exception of some of the major cities like Portland and Seattle.
Yeah, I guess I should add, I'm not an expert on it, any place outside of Massachusetts, but my understanding is that several states, other states and cities outside of Massachusetts have BERDO type requirements, and they also do not exempt hospitals. And so the states I'm aware of are Colorado, Maryland, Oregon, and I believe Washington as well, Ali. And then for cities, Denver, New York City, Washington, and also Seattle. So we're not talking about, you know, small small cities, or these are major locations with very serious requirements.
Right, absolutely. And we don't have a cool acronym for it in Washington State. I need to take that up with Governor Ferguson, that we should start building momentum around it.
I think we copyrighted it, so
Okay, that makes sense.
there's been some pushing. We've been pushed to call it NERDO, but we've resisted that.
I think Birdo is the better option there. So, you know, Rochelle, in your work for both Common Spirit and Providence, you know, we operate across multiple states, multiple geographies, multiple demographics, political ideologies. I really see these large nonprofit health systems as a microcosm of the United States, and you have to operate in different regulatory frameworks. Some at the, as John alluded to, are very resistant to this work, and others that are encouraging and pushing this work forward. So as someone who leads policy and advocacy at one of the, you know, largest nonprofit healthcare systems in the US, how is Common Spirit approaching decarbonization within the broader landscape of regulatory and policy uncertainty?
Thank you, Ali, for that question. I'm really excited to share with all of you Common Spirit's journey in this work. I will be plain spoken, coming from lived experience, hoping to be enough for all of you. I'll start by telling you a little bit about Common Spirit. As you mentioned, we are a private, not-for-profit Catholic health system, truly dedicated to advancing health for all people. We're made up of 157,000 team members and 25,000 physicians and advanced practice clinicians. And we have over 2,000 care sites, including 150 plus hospitals across 24 states. So engaging in advocacy truly is core to who we are as a healing mission, recognizing that we have a responsibility to promote upstream solutions, advocating for meaningful policies at the legislative, regulatory, and community arenas as well. We have, from our start, recognized that climate and health are inextricably connected. We see firsthand, especially the disproportionate impact of climate on those most vulnerable in the various communities we serve. And so as we approach to address health inequities and improve operational excellence and fiscal solvency through decarbonization and our climate action efforts, we really view our engagement in climate policies as both a commitment to health justice and the sustainability of our healing mission. So I'm just going to take you through the nuts and bolts too. Every 2 years at the start of a new Congress, Common Spirit develops its public policy priorities and strategies. We assess the political and overall environmental landscape. We gain input from our various internal leaders at the system, regional, market, and hospital levels, as well as with our key partners and allies. And so we further seek perspectives from our Board of Stewardship trustees, and ultimately these priorities and strategies are approved by our board. I take time to mention this because it really does begin with all the people that we touch and with bold leadership. While our priorities remain consistent over the years, our strategies are refined to account for variances and uncertainties, ultimately where we feel that our voice can be most impactful. Our advocacy structure is truly designed such that we can leverage our influence in a coordinated way, both at the federal and state levels, speaking with one strong voice on any given issue to tell our story. Keeping in mind that some issues surface differently, if at all, from state to state policy agendas, and therefore it truly does require different strategies and tactics, including working with advocacy partners and allies and coalitions to develop and advance those common ground policy solutions. I can't underscore enough common spirits enablers, and that's who we are, our healing mission. And I can't underscore enough that our enabler is really what we do, caring for people and planet. These have not changed from one administration to another. Any discussion regarding barriers, I think, begins with inaction. When we do not live up to our values, when we fail to use our voice to tell our story, educate lawmakers about policy impacts, especially impacts to those most vulnerable, needing to access the right care at the right time and the right places. We can't let barriers isolate and divide us. We need to take the time to foster relationships, to broaden the tent of supporters, lean in to see ourselves as part of a broader coalition, each doing our part together. I've seen over, the many years what moves policy agenda forward. That's people coming together, coming from a place of kindness and abundance to put people and planet at the center, relying on science and reliable data to inform policy. The biggest barriers have been the whimsy, and I don't mean that in a good way, Ali, and also the inconsistency, chaos harming of policymaking. If we are to advance meaningful climate and energy policy, businesses need some level of regulatory certainty over time. It's not easy to plan when things are skewed and blurry and when we don't have a prayer. And because healthcare systems operate in multiple states, having a national federal policy support that works for various types of hospitals would, of course, be ideal. So whether at the federal or state levels, we really need communities and economies to flourish with health and well-being as an important narrative in our climate discourses. It's very much a challenge when we are not operating from the same song sheet. I mean, we're talking 24 states here. So it's really crucial to have a system-wide plan and strategy and to be able to look at policy through organizational, very intentional plans and strategies. And I'm just so grateful that despite everything, we continue to move forward with our climate action plan. And I mentioned earlier that, our climate action plan is organized under 3 pillars. One that I oversee, the community resilience pillar, but we also have the buildings and operations pillar as well as supply chain. And they sit atop key enablers, finance, data, and advocacy. So you can see that advocacy really is such an important part of not only who we are as a healing mission, but as part of our strategy. And so I'm happy to talk a little bit more about how we do this, but I will turn it over now to you for additional questions that you might have.
Yeah, thank you, Rochelle. That was so helpful. And what I really heard from you is that regulatory frameworks, politics may shift and change, but what doesn't change is Common Spirit's mission and the commitment to serving their communities. And that's just how you've designed your program around that commitment. I want to touch on something that that you said, and John mentioned too, and John, I'm gonna ask you this. Rochelle stressed the importance of a cohesive federal framework to help organizations navigate through this. And you mentioned something I thought was so interesting, that what the Biden administration had built was a mosaic and it was not perfect. And if we were to build it from the ground up, we'd probably build something differently. So what does an improved federal framework look like to support both resilience and decarbonization in the healthcare sector?
Thanks, Ali, and Anne and Rochelle for those wonderful comments. Um, Let me start by saying that I described the good parts and I described how things came together to help us build momentum. I didn't fully elaborate on some of the gaps, and let me start there so that I can address what's needed in the next go round, which I'm optimistic we will have. Um, we have this issue in general where the folks who are really um, motivated and passionate about climate policy, whether they're in the government or in an NGO, um, don't fully get why the health sector needs to be discussed. That 8.5% of emissions that come from the health sector somehow just doesn't register, in part because it's very diffuse and it comes from a lot of different parts. It's hard to kind of point to one thing. And on the flip side, people who really wake up every day wanting to work on access and health equity and health policy kind of don't get why climate change should be on their table, why they should look at anything about that. There's so many huge challenges in health. So we have this big problem, at all levels, within individuals, within institutions, within the appropriations process, within the federal agencies, where this nexus is just not well understood. And so, for example, everything that I talked about, there was almost no specific congressional appropriation for the climate change work for the health sector, starting with my office, but moving on to the Inflation Reduction Act. Inflation Reduction Act was a very big deal for the health sector, but it was only about drug prices. The billions of dollars that were allocated for doing something about climate change and community resilience didn't really focus on health. And certainly none of that money came to the Department of Health and Human Services. So that would be the first thing, is that it has to start with Congress. And Congress has to put funds into the nexus, not into, every economy or, every building in the country, because there are very specific issues. And there has to be a little bit of a piece that's really specific for that nexus. Um, the second piece of it is that, you know, I'll say this and then we can move on and we can have other questions. I could go on about this for a long time, but um, the decarbonization and the, is an imperative brought on by climate change very specifically. And there are many links to human health. But the resilience side of the piece, which, as I said before, is very dependent on the sustainability of operations and the sustainability of energy supplies, the efficiency of the operation. The resilience part is about keeping people alive. I mean, it's about keeping people alive whether it's in a heat wave, whether it's in a cyber attack even, but there's a lot of threats to the health system. And in order to deal with climate change, you really have to be thinking forward and investing in the hardening of facilities, investing in the renewable energy microgrids, investing in the things that will keep it in operation. And the way we were set up is that the resilience side of the house was uh, was was an offshoot of the response side. And that's true whether we're talking about FEMA or the Administration for Strategic Preparedness and Response. And it's very easy in that kind of situation for the response side to be completely dominant because there's always going to be a disaster. They're always going to be deployed. The head of the response, unit's always got to be thinking about the latest hurricane or the latest cyber attack. And preparedness always gets the short shrift. So I think that if we were to build it back, I would build back the preparedness side as its own entity. The resilience preparedness, it needs its own funding, it needs its own financing. It can be revolving finance, but the fact that it was always partnered with the response side, I feel set us back years and decades.
Yeah, that's really interesting. It reminds me of the saying, the best offense is a good defense. So to be
Yeah.
prepared on the front end would make a
Every,
huge
every
difference.
dollar invested in resilience saves 10 in avoided response costs. Response is super expensive if
Yeah.
and it's more expensive if you haven't prepared adequately.
Absolutely. Anne, you said something in your opening comments that was so interesting to me. I heard you say a few times that the regulations at the city level in Massachusetts have no exemptions. And for those of us who have worked in policy and advocacy, we've seen time and time again, death by a thousand exemptions, where this well-intended policy will be put forward that is really going to drive change, but then it gets exempted into nothingness, when all of the various factors come forward. So I was going to ask, how have hospitals and healthcare organizations in Massachusetts responded to these requirements, given that there aren't exemptions? And are there notable examples of successful compliance or innovation that can be scaled?
That's a wonderful question. So I want to sort of politely characterize the responses of the hospitals, or really it's a single hospital, but it's part of a much larger system that I've dealt with. And there have been 3 levels, I'd say, of response over time. The first level is you have to exempt us, special. And the answer to that has been no, uniformly in the 3 cities. Now I'm talking about Boston, Cambridge, and Newton. With respect to their Burdo ordinances, the response has been no, we are not exempting you. We get that you're special. Everyone thinks they're special. You certainly are special, but we also know you can do it. And we're giving you 25 years, a glide path to net zero by 2050. And climate change isn't so great for health either. And as folks have said here, the health care sector is 9% of the country's GHG emissions. So no, we're not exempting you. The second response has been, you're preempted. You can't regulate us. And our response to that, well, my response to that has been, I'm a lawyer, I get preemption. We're not preempted. Also, my husband ran the agency for a period of time whose regulations you're saying preempt us. And I understand the preemption argument. I well understand the preemption argument you make. And we are, yes, with respect to some discrete issues, we are preempted, but we are not preempted from regulating you. We are not preempted from requiring you to get to net zero by 2050. And finally, the response after saying you should exempt us, you're preempted, has been, well, you just can't regulate us because we're special. And again, the answer to that is, sorry, we're regulating you. And as I've said, at least 4 other states and outside of Massachusetts, 4 large cities, including New York City and Seattle and Washington, D.C., have taken the same approach. So the answer is no exemptions.
Yeah, it sounds like you need some common spirit and Providence facilities in your jurisdictions, because we'd be all in.
That might well be true.
It sounds like some of those hospitals are going through the stages of grief, right? In processing the regulation and how to get there, but it truly is the right thing to do. And
I was thinking of explicitly making that analogy, but exactly right.
yeah. So Rochelle, I'm going to ask you our final question of our roundtable Q&A before I turn it over to the audience Q&A. And I encourage folks to enter your questions into the chat for our panelists. Rochelle, you made it very clear that Common Spirit is not backing down from your commitment to this work, really based in your mission. How do you approach it within the various jurisdictions and different regulatory frameworks across the number of states in which you serve? Do you talk about it differently in some states? Do you not act as proactively in the advocacy space in some states, or how do you navigate that?
So, Ali, I wish we had the luxury to grieve. And, I see from the chat here from Kenna, when we build it back, I completely feel, the frustration and the challenges that we are feeling right now. But guess what? We can do a lot and freely. Okay. I mentioned how important it was to have a system-wide plan and strategy, coming from the very top, and how it's really trying to take life, in the various places that we are. We have a carbon a reduction goal, to go net zero by 2040, with an interim goal to have our GHG emissions by 2030. And yes, it does require strong federal policy strategies, but we must do what we can do. And looking at how we can align strategies and plans at the state and local levels is really key. And I know that there are a lot of actions being taken by our states and regions. They play such a vital role, and I think that we need to continue to empower that kind of action. Because states are, certainly developing and testing innovative solutions. They're trying to deliver on near-term emission reductions and lay the groundwork for resilience strategies that could spur broader action. In the 24 states we're located in, there is some form of a state climate action plan that generally includes some form of GHG reduction targets and some detailed actions that state can take to help meet those goals. And these plans certainly include additional components such as resilience strategies, clean energy targets, and economic social goals. I would direct our webinar participants to c2es.org, Center for Climate and Energy Solutions, to see the status of your states regarding GHG targets, climate action plans, and various state climate policies that are in place and not in place, right? We recognize that each of our states have unique circumstances, landscapes, priorities, and resources. And we know that we cannot do it all at once. Our hospitals are facing such an incredibly difficult time right now. But this is where our advocacy partners have been so crucial, right? Working with Series BICEP, for example, which stands for Business for Innovative Climate and Energy Policies, they help us to assess what is our part to do, identifying strategic opportunities consistent with our policy priorities that support the advancement of our overall common spirit CAP, our climate action plan. And so in the absence of stronger federal actions, at the state level, we really need to see how much we can do to push, some of these climate policy and energy solutions forward. I wanted to just give an example of how our state engagement has been successfully worked. We helped to pass SB 253 in California. That's the Climate Corporate Data Accountability Act. It's now in law. It requires entities doing business in California with over $1 billion in annual revenues to disclose their scope 1, 2, and 3 greenhouse gas emissions annually. At a system level, Common Spirit is already voluntarily reporting on our GHG emissions through CDP. So weighing in support of this bill was not a stretch, but an extension of our work to get at data that will better inform our climate strategy. The California Air Resources Board is currently working to promulgate regulations for 2026 implementation, and we continue to stay at the table to remain actively engaged, providing comments to finalize those regs with other leading companies. And then I just wanted to point out also that for Arizona, California, Colorado, Idaho, Montana, Nevada, New Mexico, Oregon, Utah, Washington, and Wyoming. Together with BICEP, we're currently supporting the development of an expanded organized wholesale market or regional transmission organization for the West. And this is designed such that, markets can be more organized, covering a wide footprint across the West. It would lower energy costs and improve reliability of the power system for everyone, and would help customers meet their energy goals, including increasing access to zero carbon resources. Having led in California and in other states, together with our partners, we're really able to provide policy expertise and experiences to help other states where we have presence and influence. And we hope that it would help to navigate, the advancement of these meaningful, harmonized policy solutions. And yes, to your point, Ali, again, every state is different circumstances, different policy structures and makeups, right? But we have to find a way to educate, to tell our story, to find the words that will connect with other people, to use the language that can cut through, the muck and mire. If you don't want to talk about climate change, we don't have to talk about climate change. Can we talk economics? Can we talk about how LED is saving us money? All the points that John had mentioned, this is about sustaining our healing mission. And when we put planet and people at the center of conversations, it's really amazing what productive dialogue can happen. And so that's my story, and I'm sticking with it, Ali. I think there's so much that we can do. It is who we are and what we do, and no one has to tell us. Not government, not challenges and barriers. We can tell ourselves that we can do this because our healing mission depends on it.
Yeah, well, thank you, Rochelle, for leading the way, and Common Spirit being one of those leading advocates in the private sector that's filling the void left in certain spaces in government. So moving to our audience questions, we're going to try and get through as many as we can, time permitting. So apologies if we don't get to your question, but perhaps we can follow up in writing. But so David has a question that because this is titled Legal Implications, he has a question about for attorneys interested in suing healthcare policymakers and providers for their level of carbon emissions, creating known harm that results from carbon emissions, and the refusal to divest in fossil fuels. Is this something that is I sort of alluded to this in the opening around increased liability in this space, but is this something that our panelists are tracking across the healthcare sector, or has been an area of concern or awareness? And you're our resident lawyer, so any thoughts?
I thought that was coming. So obviously answering off the top of my head, I would not be hugely optimistic given the litigation that hasn't succeeded already. I think there's a case in Montana that's going forward successfully, but in general, suits against both oil companies and against government entities saying, worded in various ways, you have an obligation to provide us with a healthy climate or healthy environment or livable world or whatever. Those suits in general have not been successful. That's not to say that won't change over time as public awareness increases, because obviously judges are not blank slates, as we're seeing more and more. But I'd say the most likely litigation strategies to be successful would be failure of policies or regulations to comply with the statutory requirements. So, for example, the Clean Air Act has lots of requirements respecting not just greenhouse gases, but also particulate matter, right? So to the extent the administration, for example, tries to undo regulations that address those statutory requirements, or promulgate regulations that essentially nullify those statutory requirements, I would think those approaches to litigation would be more likely to be successful. That is, look, there are laws on the books that require X, Y, or Z. You're not doing X, Y, and Z.
So that connection to existing statute is critical. Yeah.
I mean, the Congress in the days when it legislated passed some very important climate legislation. I mean, several iterations of the Clean Air Act, Clean Water Act, NEPA. There's that's at the federal level, and at the state level also. There are, at least in Massachusetts, where what I'm familiar with is very stringent statutes. And so regulations, we talked about preemption earlier, regulations can't undo or nullify statutory requirements. They're still in place.
So our next question, thank you, Ann. Our next question from John and for Josh, excuse me, John, I'm going to direct it to you. It's from Josh. One common theme in recent reporting is that folks around the country are not drawing the connection between IRA funded, Inflation Reduction Act funded clean energy projects and the proposed repeal of the IRA. How do you work to make sure providers and patients know and that clean energy on campuses exists and is IRA supported? And I would add one step further that the majority of funding from the IRA is going to Republican districts and in Republican communities. So how do we make that connection more clear? I'll start with John, but please, Ann and Rochelle, if you have thoughts, please weigh in as well.
Yeah, thanks, Ali, and thanks, Josh, for the question. And there is the provider side of it, of communicating it, within the institution, within to the patients, et cetera, where it's happening. I'd say there's two kind of crossing issues there. One is there are a lot of organizations that are trying very, very hard to document where the funds are going, documenting what you just said, Ali, that a very large part of the funds are going to states that have voted for Republican candidates or are represented by Republican representatives in Congress, to show them the benefits of the Inflation Reduction Act financially to their states and their districts, and consequently what would happen if they repealed it to their own constituents. That work is going on. The challenge to that work is that the Inflation Reduction Act was only passed in 2022. It was only implemented in 2023 and 24. That was last year. A lot of the projects are still in the pipeline. A lot of the results are still yet to be seen. We've been trying, Healthcare Without Harm is really leading the way within its own Climate Healthcare Council and Practice Green Health to get people to share the successes of the Inflation Reduction Act, because of course, especially now, but even before now, there was no way to get that information very coherently. That information isn't always collected. So it's a challenge to get it because a lot of it is still not yet realized. The big question is anybody listening? The big question is, we can make this case till we're blue in the face to the representatives we see, I'll just talk vaguely. We see stories of individuals, expressing concerns, ethical concerns, moral concerns, political concerns about what is going on. And then when the vote finally comes, the vote is in line. So the question is anybody listening to not just the harm to people, because we can make that case very, very coherently, but the harm to representatives' own constituents. Is anybody listening to that?
Yeah. Ann or Rochelle, thoughts on how to help them listen?
Well, I don't have a solution to the messaging problem, but I just want to add one thought, which is we've been talking about, well, for example, clean energy in light. We've been talking about the jobs benefits, the economic benefits. I would add to that for New England, the reliability, not just benefits, but imperatives. the electric system reliability. So here in New England, our biggest renewable resource is offshore wind, dwarfs everything else, dwarfs solar, dwarfs Canadian hydro. It is our big resource being very seriously threatened. And it's understood mostly in New England as an issue of addressing climate change. But in fact, it's an issue of keeping the lights on as well. And so I think when we talk about, look, we're talking about clean energy, but there are benefits other than climate to the climate. There are economic benefits, there are jobs benefits, at least on the Eastern Seaboard. The reliability of the electric grid is closely related to what we talk about in terms of climate policy.
Thank you. Rochelle, anything to add?
So I think the most pressing issue for healthcare right now, and I will just address it, the big elephant in the room policy-wise is HR 1 and, looking at the Senate's version of the budget reconciliation package, right? It has a lot of things in there that's harmful to communities. And I know that we are overly exercised on protecting Medicaid, right? And I know that there are, provisions in there around the tax credits and the energy, right? And it's so important that we not see ourselves as single issue people, single issue organizations. And I think the way that we can tactically do that right now is to really lean in on partnership, allyship, being able to really encourage one another to speak from our particular perspectives and to join together to present a very comprehensive story of what these harms are going to do in the communities that we serve, right? And so right now, as we are very focused on speaking on Medicaid, we are also joining again, with series, with Healthcare Without Harm, with businesses to really talk about how is it that we see health in such a way that it's about making sure that we keep our doors open, because the very people that are going to suffer from the cuts of Medicaid are the very same people who are being disproportionately impacted with climate, with the climate inaction that is going on, right? So we need to tell that very, very comprehensive story, and we need all of us to be able to say it from the places that we are, because I think the truth is so important. And our voices, when we come from, the authentic places in which we stand, that's everything. And that's what's going to keep us moving forward.
Yeah, and Rochelle, thank you for reminding us that all of these things are connected. Healthcare access, environmental sustainability, and these issues of healthcare access, environmental sustainability are not political issues. They're a matter of health, equity, and justice. So I want to thank our panelists for their incredible insight as we navigate this very complex landscape. And again, for my PSA, that this work is not political. Advancing sustainability is not about taking sides. It's about doing what's right for the health of our communities, for future generations, and for the common good. So thank you for demonstrating ways that we can continue to do this together. Have a wonderful day, everybody.
Thank you.
Thank you.
Everyone.
Great job, Ali.
Thanks, everyone.